Effort. It's a
trying to reset it to just get started.
all right, we're going to get started. Welcome, everyone. It's Wednesday. Thanks for joining us for the May 13th briefing. And we're going to cover a few different topics today. I think we're going to start out just want to thank everyone who tuned in for the telephone town meeting. Yesterday, we had with Dr. Leffler and Dr. Josh Sharfstein from the Johns Hopkins School of Public Health. It was really quite an opportunity to have Dr. Sharfstein with us. He is one of the leading doctors in public health experts really in the country on this, and that this whole session has been archived, and I'd encourage anyone who missed it. It's about an hour long, and I think it really is one of the best conversations we've had here yet about what restart looks like. And Olivia, why don't we go back just quickly to that first slide? The topic last night was about restart and why we think we are ready to continue the slow, incremental reopening of our community, and how we should do that is fundamentally what we covered last night. This is a map up here. We touched on this briefly last night. There's something called COVID Act Now, which is a coalition of data scientists and public health experts, and they have set up this website to take data from all 50 states and assess the threat level of the virus, essentially, and which states are ready for reopening. As I think is widely known, this pandemic is really been managed by the states. The federal government missed the opportunity to interdict and keep this virus contained at the beginning of this pandemic, and now each state is really being left to manage its own crisis, and that has led to a real patchwork of different governmental responses and a real patchwork of different outcomes. And what this map is showing is that Vermont, almost uniquely east of the Mississippi, and one of only two states, and this is the map as of yesterday. I think I may have seen today's map, maybe West Virginia has gone green as well, but basically one of the very few states in the continental US that has met all the conditions that the consensus of public health experts say is important to meet to safely, or as safely as possible, move forward with reopening. And one of the metrics, or a number of metrics that they analyze, one of them there is on the right side of the screen. The infection growth rate has been below 1 for some time. That's an indication that for each person that becomes infected, less than one additional person becomes infected. When that rate is at 2 or 3, that's when you see exponential growth of virus infections. When you keep it suppressed below 1, that's when you actually see the virus on a trajectory towards dying out. And we do know there are very few new cases of infections right now in Chittenden County or the whole state of Vermont. So we have a big job. No one is by any means declaring this emergency is over. We know we have many challenges ahead, and we may face setbacks in the future, and I think we should be conscious of that. But at the same time, I do think we should take confidence from this early success in this response to the virus. We are at the, as Dr. Leffler said last night, we're at the end of the beginning, and this first chapter of Vermont is ending before really just about any other state, and are relatively well positioned for the next phase, which is trying to safely reopen parts of the community that have a high social impact. And we'll have more discussions about that I think it's going to dominate public discussions for months, and certainly these briefings. But anyone, again, if you want for more on this topic, check out the archive either on our Facebook stream, or I'll say Channel 17 does an outstanding job of archiving and making these resources available. You can check out their archives as well. Similarly, we had another further conversation on my public coffee this morning, and that too is archived on the Facebook stream, and you can check it out. Let's keep going, Olivia, and let's talk about one of the programs that we have set up to respond to this emergency. Is the something that we have excuse me. So on April 6th, the Burlington City Council, working with the administration, unanimously supported an unusual action. Basically, the city is saying Burlingtonians can, if they have been negatively impacted by the COVID-19 emergency, can defer their June property tax payment, including the business personal property tax, this tax that businesses pay on the equipment that they own. Any tax-paying entity can defer that payment from June until then, when the next payment is due in August, without any penalty, no interest, so long as they fill out a simple application and state really why they need this. And that application is now available as of Monday. And we encourage anyone who is interested in this program to apply. We do need you to apply if you want to take advantage of this benefit. And the applications are due by June 1st. The application is easy to find on the city website. You can go straight to that route, or go just to the homepage and it's the resource and recovery page. You can find it there. If you have any trouble finding the application, let us know at the resource center. We'll help you find it. And that's where this program stands now. So I want to be clear with everyone who's considering applying for this, that at this point, that benefit is limited to that deferral. In August, on August 12th, both the June payment and the August payment are currently due. We do, all property taxpayers always have an abatement option available to them, and that is a established formal process with lots of precedent and case law around it. And that is currently the route that is available to people who need to seek further relief. We are exploring whether the city could proactively do anything further or give any further guidance to the Board of Tax Abatement about how to treat COVID-related abatement requests. We are going, there's a number of factors that impact how the city is thinking about that, and is what else if anything, we might be able to offer, and what additional guidance we might be able to write. The applications for this first abatement will help us determine that. So again, that's another reason if you think you might need help beyond August 12th because of these exceptional circumstances that we all find ourselves in with the COVID-19 emergency, filing your application will help the city assess this situation and what else we are in position to do to work with property taxpayers going forward. We'll have updates on that, I'm sure, over the course of June after those applications are due and we've had a chance to analyze it. And also another factor here is that the state is also considering whether it will continue to require, as it does now, municipalities to make full payments to the Ed Fund, regardless of whether or not we have received the tax payment from the property taxpayer. The city owes the full Ed Fund payment and faces very substantial penalties for late payment. And the legislature, our understanding is reviewing that and looking at whether they can offer any flexibility to municipalities or somehow address the situation. So that too will impact what city policy we can provide from here. Moving on, Olivia, we're going to move to a discussion of the opioid epidemic, which is on. There remains a crisis here in the state of Vermont, even as we are hit with another public health crisis. Olivia, is Representative Colburn on the line? Has she joined us yet?
I'm here. Can you hear me?
Okay, great, Representative Colburn, thank you. Great, it's amazing the technology works. So I'm going to hand this over in a moment to Representative Colburn. Last week, the state released the numbers for 2019, which we had been anticipating, looking forward to that release for some time. And there was a lot of focus on the fact that for the first time in years, the total statewide overdose deaths, which is this key metric, critical measurement of how we are doing in the fight against the opioid crisis, that is headed in this right direction statewide for the first time in many years, and that is good news. I think not a lot of attention, however, has been paid to another very significant story in those numbers, which is that for the second year in a row, the Chittenden County, the significantly largest county in the state, maintained a very low rate of deaths relative to where we were a couple of years ago, a rate of 11.5 deaths per 100,000 people. So, as we say that, every single death is a preventable tragedy that we mourn here and know represents just great disruption in this community. At the same time, that rate of 11.5 is about half of what it was 2 years ago. And the fact that the able to sustain that much lower rate of death for a second year in a row is something to take confidence from and something to welcome. And I don't think it's an accident. I think the fact that we've done it now a second year in a row is further evidence that the very proactive, robust set of interventions that Chittenden County local institutions, the city, the hospital, the treatment community, Howard Center, prosecutors, defense lawyers, a very large coalition of actors have pursued together for years. We see for a second year in a row that those gains have been consolidated and remain there. And one of those, and I think if you had to sum up what we have done as a county, and I welcome Representative Colburn's take on this in a moment, but I think if you had to sum up what Chittenden County has done right, it is that we have fully embraced the science behind medicated assisted treatment. And we have really unambiguously signaled that we think buprenorphine, Suboxone, as it's referred to, is a medicine. It is a life-saving medicine. It is a medicine that we still know that too many people struggle to get access to, and that we should be breaking down barriers to that access. And one of the ways that we do that is through, we no longer in Chittenden County arrest people and prosecute them for the possession of non-prescribed buprenorphine. We know that a kind of hallmark of this disease is that some people do try to medicate themselves by securing black market buprenorphine. These are people who are not yet ready, for whatever reason, to go into the clinical setting and secure it, even though that has been made significantly easier in recent years. And in Chittenden County now, that is no longer something that Burlington police arrest for, and it's not something that the state's attorney has prosecutes. And there has been an effort to expand that posture by law enforcement to be a statewide policy. And the leader of that has been Representative Selena Colburn, a Burlington representative who is now here with us. And I thought this would be a good moment, Representative Colburn, for you to kind of share the status of that legislation. So welcome.
Thanks. And thanks for an opportunity to talk about this, Murrow. I really appreciate it. So the bill in question is, the bill number, if people are interested, is H-162. And just in a nutshell, the bill has evolved a little bit as it's made its way through different House committees. But what it does is really tries to mirror what has happened in Chittenden County, just at the discretion of prosecutor of State's Attorney Sarah George, working in collaboration with the police department and Mayor Weinberger and others, is it decriminalizes just small possession amounts of buprenorphine. So as introduced, it decriminalized any misdemeanor possession amount. It's actually been amended by the House Human Services Committee to kind of make that an even smaller amount, but it allows people to have a few weeks personal supply of non-prescribed buprenorphine and not be prosecuted for that. Can everybody still hear me?
Yes, you're doing great. We can hear you.
Great. Sometimes I do have a little bit of internet stuff, and it looks like the screen might have frozen for a second. So, and the reasons for this, we know a few things about why this really makes sense. One is that we know that although Vermont has done a great job creating a treatment system that's a national model with our hub and spoke system, we know that actually the majority of Vermonters who are struggling with opioid use disorder are not receiving treatment. And an evaluation of our system that was done a couple of years ago tells us that some of the reasons for that are lack of access to transportation, to childcare, to providers, that some of these there are some barriers in place in our treatment system. We also know from just national studies that self-medicating is really the primary reason that people are using non-prescribed buprenorphine. So to try to prevent going into withdrawal, to try to be able to stabilize their lives because of the effects of this medication. And then finally, we also know there have been a number of studies that tell us that folks who start using buprenorphine without a prescription, and this really surprised me when I learned this, but I think it makes sense, who then enter into supervised treatment actually do better at maintaining treatment than people who are just coming to treatment in a supervised setting for the first time, because they've been able to have some experience with the positive impacts that this medication has in their life. So that's kind of the reason behind the bill. And where it's at in the legislative process, we are at a very unique moment in time. And so this bill has had a long path. It was introduced in 2019 and passed out of the committee that I serve on, which is the House Judiciary Committee. And then it spent quite a long time in the House Human Services Committee, where they were really, really vetting the bill and made some further amendments to the bill to address concerns about decriminalizing the full misdemeanor possession amount and just some smaller things, but also just really took some time to have conversations, to hear lots of different testimony, to hear all sides. And eventually, I think quite miraculously, that bill passed out of that committee on an 11-0 vote. So cross party lines, was unanimously supported. Unfortunately,
I don't think I realized it was unanimous. Wow, that's really a great
I think the amendment really helped. And just the time they spent with it. Unfortunately, that happened 2 days before the legislature adjourned our in-person operations due to the COVID-19 crisis. And so it is, we actually voted on that bill today to postpone action until June 3rd, as we did with just a number of bills that are essentially sitting on the notice calendar in the legislature from kind of the time before. We really shifted our focus. We have really shifted our focus to responding to the COVID-19 crisis, and we're not really moving much legislation forward right now that doesn't have that focus, or that isn't about just stabilizing the state's financial resources in the form of various budgetary provisions. And so the future of that bill is, as is the case for many bills, is a little uncertain. It is likely that the legislature, we will probably be working well into June. And it's a little unclear if, as time goes on, we may be able to pick some sort of non-COVID bills back up. I would certainly argue that this bill has importance and utility in the current crisis, but it's not a direct response. And then it's also likely that we'll be going back to the legislature in the late summer and early fall to do a final budget after federal tax filings happen. And that may be another window of opportunity to move some legislation forward. But the bill does have some challenges at this point, just in terms of the way the legislature's priorities have shuffled. And because the Senate really hasn't had a chance to take a look at this bill yet. And now their window to do so is further delayed. And as you can see from its path in the House, it did take some time to really get people behind this bill, to understand the science and the public health argument for it. And so I think the bill now has two challenges. One is just getting out of the House as a priority, given all of the ways that our work has justifiably been upended. And then the second is, getting the due time and process for it in the Senate committees that it would need to go through. So that's where the bill is at.
All right. Well, thank you for that update, Representative Colburn. I think I failed to say in my opening on this. It's not just that the Chittenden County rate of overdose deaths for second year is at about half of what it was in the peak. It's also substantially lower than the death rate in many parts of Vermont currently, and that notably so. Half or even a third of the death rate of some of the worst counties in Vermont. So. While I'm certainly sympathetic, we're working very hard here in Burlington in the response to the opioid epidemic. In response to the COVID-19 crisis. This is an unprecedented emergency in a lot of ways, and is certainly commanding the lion's share of our attention. With the restart, that I don't know if you heard some of my opening here today, but the conversation we've been having this week and last week, we are at a point where we have we're kind of getting past the first stage of this crisis, and we are now entering a long stage when we are going to be dealing with the virus, figuring out how to live with the virus, figuring out how to effectively reopen as much of our society as we can safely. And I don't think we will have the luxury of just indefinitely waiting to move on other issues while we're going to have to do both things. We're going to have to do a lot of things while dealing with this virus. I think while I'm certainly sympathetic to only taking the highest priority items, I certainly hope this stays on the radar screen of the legislature in June as a matter of life and death. I think it's really not, we have lost far more people to the opioid epidemic at this point than we have lost to COVID-19. And these are preventable deaths. These are tragedies that don't need to happen. And one of the, very significant things that the state could do to signal its belief in the science, and we're hearing a lot about setting policy based on science with the response to COVID-19. I think Vermont has done an exceptional job of that. We should be setting our criminal justice based on the science as well. And it's really compelling that was an 11-0 vote. Are there any notable? There was a time when the state's public safety department was very opposed to this bill. Has their stance changed in any way?
I'm not aware that their position has changed. I think early on in his tenure, Commissioner Sherling voiced concerns about that legislation moving forward. I'm not sure what he would say today about it. But I couldn't agree more with your assessment, Moreau. I think it's really important that we don't, that we continue to move forward legislative priorities, especially those that do really have life and death consequences for Vermonters. And I hope if people listening feel strongly about this bill, which again is H-162, that you'll feel free to reach out to your representatives and let them know that you think this is a priority that should move forward.
And basically the way our system works, is it right that if this does not pass in the June session, and I'm a little unclear what the plan is after that, is it possible the legislature will come back into session again before the new legislature is seated after the fall elections?
Yeah, it's almost certain. After the fall elections, I'm not sure. So the current anyone who's an elected legislator now, their term doesn't end until really the end of this year, and so we will certainly go back at some point in the late summer and fall because we are only able at this point to pass a budget that carries us through the first quarter of the coming year, because we just don't have the revenue projections to do a full budget. So we're essentially doing a budget adjustment right now. We'll vote on that at the end of this week. And then just for the current year to deal with all of the changes in our different funds that we're seeing and to distribute some of the federal monies. And then we'll do a first quarter budget before we adjourn in June, and then we'll have to come back in the fall. And so that may be there may be another window of opportunity to pass additional bills. Okay, all right. So that might be another opportunity. If it doesn't pass, then it would be back to square one with the new legislature, though. Is that right? So it would be. We'd have to reintroduce the bill anew and start the whole process over from the beginning. All right. Well, certainly I think this is an idea whose time has come. I agree with you. I think this idea in some ways is more important now amidst the emergency than ever. We know that this is a time where, despite there have been important steps taken to recognize that it is harder to get to doctor's appointments and get prescriptions than in normal times. So, I fully support those steps. And
there was actually enlightened steps by the federal government that are welcome and I think should last beyond the end of the emergency. But I don't think we should just rest on that. I mean, we know that it's hard to imagine that some individuals are not struggling even more to access buprenorphine through clinical means. I think the need for this is greater than ever. I hope when you guys come back to this bill in June, it will go forward. I fully support that. I want to help you in any way I can, Representative, in moving that forward, and keep us posted, and maybe you can come back on another one of these briefings if there's any kind of update on this.
Okay, well, and thank you, Moreau, for your and many in the city for your support of this bill and just a number of life-saving measures, whether it's the work that we did together to advocate for medication-assisted treatment access in our correction system, or the really important work that you all have done to push for low barrier access at safe recovery and local emergency rooms. I think all of that work just made a tremendous difference in the reduction that we did see in overdose fatalities this year for the first time in 5 years, I think. So I really want to thank you and the city for your efforts overall on this issue. And yeah, I look forward to continuing to work with you on this.
Thank you for that. If you can stick, I know you got to get back to the floor very soon. Do you have time? We could go and see it. We have some members of the media on the line. I don't know if anyone has any questions. Do you have time for? Okay, Olivia, why don't you invite any questions? Either today.
Great. So for members of the media who are tuning in, the usual process, please email me any questions that you have. And then if you are on Zoom, the new process is that I can enable your microphone so you can ask the question directly. It doesn't look like we have any questions coming in yet.
Okay. All right. Well, let's keep going. Maybe Selena will be able to stick around. At some point, she does have to get back to the floor. Let's keep going. We have a couple other short items. What do we have left here, Olivia?
Just our fun at home resource.
That's what I thought. Okay, so you may recall on the, I think it was the Monday briefing, we announced Kids Week, replacing Kids Day this year, a week of virtual activities. And it continues with this Fletcher Free Library produced amazing original music video. And you can check this out at the btvkidsday.com website. And this is another piece of programming that joins the scavenger hunt involving Burlington Wildways and the virtual parade that took place on Saturday. The kind of cultural team at the city has done a great job with replacing this institution of Kids Day. That I think this is the 35th year of Kids Day celebrations. Thank you to the Fletcher Free Library for this video. And with that, have we heard? Has anyone else chimed in, Olivia? We heard from any members of the media.
No, it looks like we might be all set for today.
All right. Well, thank you again, Selena, for tuning in. And thank you to everyone else who joined us today. We'll be back again on Friday with an update before heading into the weekend. We expect there could well be additional announcements from the state about this current restart early phase that we will want to kind of process together and talk about on Friday. And we will have more local updates for you as well. So thank you for tuning in today. We'll see you in a couple of days. Stay safe, everybody.